Bill's Health Pills, your daily short for good health and longevity. Importance of regular nut consumption. In the early 1990s, researchers at Loma Linda University published 2 landmark studies that highlighted the cardiovascular health benefits of eating nuts. Since then, epidemiological and clinical studies on their health effects have increased exponentially, and results have consistently shown a 30 to 50% lower risk of heart attack, sudden cardiac arrest, or cardiovascular disease for those who eat walnuts several times a week. Also observed in nut eaters were improved lipid profile, endothelial function, attenuation of inflammation and oxidative stress, decreased insulin resistance, and beneficial effects on gut flora. Unfortunately, available data indicate a downward trend in their consumption for most of the 20th century. Large segments of the world's population do not consume nuts on a regular basis, and for those that do, they account for a very small percentage of total caloric intake. Recently, a new study looked at these issues using data from over 169,000 women and 41,000 men from 3 large surveys conducted. These surveys were the Nurses' Health Study, Nurses' Health Study 2, and Health Professionals Follow-Up Study. The analysis took into account many factors such as age, race, body mass, physical activity, smoking, current use of multivitamins and aspirin, family history of diabetes, heart attack or cancer, personal history of diabetes, high blood pressure or high cholesterol, alcohol consumption, red meat consumption, and fruit and vegetables. Compared to those who consume no nuts, or almost none, such as regular nuts, hazelnuts, almonds, etc., those who included them in their diet 5 or more times a week had a 14% lower risk of cardiovascular disease and a 20% lower risk of coronary heart disease. The results were similar for peanuts, technically legumes, but with a nutritional profile similar to nuts. Intake of peanuts and regular nuts was inversely proportional to stroke risk. An important limitation of the study was the lack of data on how they were consumed, e.g. salted, raw, or roasted. However, frequent intake of nuts was associated with a lower rate of cardiovascular disease, independent of other aspects of lifestyle and other risk factors. All this supports recommendations to increase their consumption as part of a healthy dietary pattern to reduce the risk of chronic diseases in the general population. You've been watching Bill's Health Pills. Please like and subscribe and leave us a comment. Let us know what you think. And if you have ideas for other topics, let us know.